Hi, this is Steve Dale, and today I want to talk a little bit about the Life Passage Planning Project with a focus on a supported living services agency called East Bay Innovations, which serves Alameda County here. So a little background about what this is all about. We at the Golden State Pool Trust have been on a quest for quite some time about how we could better serve our beneficiaries here in their communities. Here, and we looked across the country at different programs of different pooled trusts to see if there was something we might be able to adapt. Now, our board, which is made up of a number of leaders of different disability organizations, also have some supported living services agencies on the board, and the question came up, why don't we partner with existing agencies that already do much of what we're looking at doing with a real focus on supported living services agencies and work with them to partner to better serve our beneficiaries. And this is the foundation of the project here that we're going to talk about. Now, the Life Passage Planning Project here has been funded by the May and Stanley Smith Trust and Posey's Family Foundation, and much of what we'll be doing will be studied during this process so we can put together best practices guides here, as well as guides on how this could be implemented across the country to eventually build a network of community programs that can serve persons with disabilities across the nation. This project is overseen by the Stetson University College of Law and their Special Needs Trust program, which is the leading program for special needs practitioners across the country, and does an annual program in October here on a variety of subjects on special needs trusts. And it has and it is the leading program here, and it's a must attend for all practitioners who work with persons with disabilities with a focus on special needs trusts, both drafting and implementation. So the guiding principle of this is to adapt and improve existing systems, concepts, and resources in a way that better serves beneficiaries of special needs trusts. The Life Passage Planning System will develop and implement a system of assessment and delivery of services to beneficiaries of special needs trusts that coordinates the efforts of all stakeholders to provide a quality of life to beneficiaries of special needs trusts in a way that has never been possible before. The Life Passage Planning System will work with participating programs that can easily adapt to the system to deliver services to beneficiaries at a higher quality and lower cost, while providing the agencies a sustainable stream of income higher than the rates that are currently received by government agencies here. Now, who's going to benefit from these activities? By creating a standardized system of assessment and delivery of services, trustees will have the ability to increase their capability to serve their beneficiaries by creating access to services currently not available to many persons with disabilities. For instance, beneficiaries with a mental health diagnosis cannot access many of the services of supported living services agencies, which are currently only available to regional center clients with intellectual and developmental disabilities. This project will allow trustees, including the Golden State Pool Trust here, to broaden their ability to serve beneficiaries and take these services cross-disability and make them available to all here. So, while the Golden State Pool Trust is taking the lead on initial development of the Life Passage Planning System in California, this is a non-proprietary project that is open to all. If you are a fiduciary, consider how utilization of the Life Passage Planning Agency can improve your capabilities of serving your beneficiaries. If you are a family member who's concerned about the quality of life for a loved one, consider how this could help to expand your ability to serve your beneficiaries. And if you're an attorney counseling persons with disabilities and their families, consider how trustees using these services can better serve your clients and beneficiaries. So it's my great honor to introduce here Tom Hines, who's the Executive Director of East Bay Innovations, followed by Christine Grabowski, who will talk about how they are implementing this program in Alameda County. Okay.
EBI uses a person-centered approach, and before I get into person-centered approach, I want to assure the folks that are in the audience, all our staff go through a rigorous vetting process before they're hired. We do criminal background checks on our staff. We also have professional liability insurance, and we're bonded. All that to say that we want staff who are going to understand the people we serve in a person-centered way. Person-centered is a term that comes up a lot, but basically it means trying to understand the whole individual before you start services. You know, what's their history, what are their likes, what are their dislikes, what are things that are challenges or things that make them fearful, who are the closest people in their lives. And we try very hard to build a foundation of trust with people that we serve and their close family members and friends if they have family members or friends around them. That enables us to get through challenging times with people and for them to trust us when they're going through a challenging time. We train our staff not to be judgmental when people make decisions that might create a challenge, but to be a positive force to help them get through that problem or issue. Sometimes we work with folks who have had bad experiences with service providers in the past. If that's the case, we want to know what didn't work in those situations so we don't replicate it. We really monitor our staff to make sure that they're providing services on a timely basis and they're following through on all the areas of support that the person needs. Follow through is a big issue, and follow through is one of the main ways that we build trust with our clientele. We also sometimes serve people who have had no service provider in their life at all, and they may not see the need for a service provider even though those around them see a big need for a service provider. In those situations, we slowly and gradually work with folks to demonstrate that we can be helpful in situations where they're carrying the load. They're struggling to hire their own in-home support services staff, for example, or deal with a Social Security issue. And when we see opportunities to help the person through something like that, they usually feel a sense of relief and then start to trust us to help them with their lives. And now I'd like to introduce Christine Grabowski, who's our Director of Life Planning Program with EBI.
Hi, thank you for having us today. My name is Christine Grabowski, as Tom said. I've been with EBI for 10 years. I was lucky enough to start off as a direct support staff in the independent living program, where I sort of learned all about the benefits, affordable housing, and now I'm lucky to be heading up the new life planning program here at EBI. EBI's life planning program works with beneficiaries and fiduciaries, providing quality, cost-effective service and maximizing the longevity of funds and client special needs trust. Life planning program services consist of one-to-one case management in the beneficiary's home and community. Ongoing life planning hours are determined based on the beneficiary's needs and typically do not exceed 40 hours per month. EBI's case managers offer ongoing wraparound services, which include the following, but not limited to: maximizing use of publicly funded services and generic resources. When we talk about generic resources, we're talking about, for example, income would be supplemental security income or SSDI, Medicaid, Medicare. It could be cash aid if they qualify it, or for food stamp programs. Locating affordable housing. Like Tom said, we don't provide the affordable housing, but we do help people apply for affordable housing. We do a lot of work in the field, working with property managers and making sure people get on as many wait lists as possible. That would include any Section 8 open wait lists that might come open during the time we're working with the beneficiary. Accessing appropriate healthcare and assisting clients to follow treatment plans. We would work closely with the client. It's their choice, but if they are looking for a new primary care physician or a specialty, we would work with them in helping them advocate on their behalf medical plans that fit their current need. If they're looking for mental health treatment, we would help them access finding a mental health team, working with a therapist, and helping them access those and making sure they would have transportation to and from appointments. If needed, we could provide the transportation to and from. Teaching budgeting and money management. Working within someone who lives on a limited income, this has really been an important part of my training in EBI. Teaching people how to live within their income, how to budget, how to plan, how to make sure they have enough money to get through the end of the month, living on the income that they currently receive. We would work with their trust to make sure that if they did need money, that we would be going to them first. We are not responsible for the person's money. We cannot get access to the money. They would still need to go to their trust, but we would help them advocate if needed. Advocating for and maintaining disability-related public benefits. If someone has Medicaid but finds themselves with a large share of costs, which they hadn't had in the past, we would work with them and with their local Medi-Cal office and social worker to help them reduce that share of cost. Or if they had to renew for their SSI benefits, we would help them if they requested to reinsert for their income benefits, excuse me. Assisting with recruiting, hiring, and training in-home workers. In-home workers, or also known as IHSS, is a benefit through the Medicaid program. If someone qualifies for Medicaid hours and they're living independently and needed the support, we would help them learn to access the website where they could find workers, interviewing them, hiring them, making sure they understand how the time cards work and how to submit them. And also, if they needed to, how to train their workers. Addressing safety at home and in the community. Before we would move anyone out into the community, if they're living, let's say, in a group home, we would want to make sure, we would have a nursing assessment to make sure that they could live safely on their own. Once this plan has been established, we would make sure that all the areas were set up that needed to make sure they could live safely in their home. That also includes in the community getting around if they would need transportation, paratransit services, or if they just needed BART tickets or AC Transit, we would make sure that they had those resources set up prior. Promoting activities and opportunities, enhancing quality of life. Just moving someone into a community isn't just about moving someone into a house. Setting them up for success, having them get to know their community, what's around them. Also finding out from the beneficiary what their interests are. What do they want to do? What are they interested in? That's part of being a direct support staff, is really getting to know the person and what their dreams are. Do they want to attend a class, or do they want to join a gym? Those are an everyday part of life that all of us get to do, activities, making sure that they have those friends around them that they want to have, or if they're trying to reach out to family that they haven't had contact with in a long time. We could help in those areas. Maintaining case records, documentation, expenditures for monthly reports to fiduciaries. At the end of every month or in the beginning of the next month, we would make sure that the fiduciaries received a statement with a breakdown of costs, what the hours went to for that month. For example, if we were working on housing and working on obtaining current ID, that would all be indicated along with detailed case records. What is the process of engaging EBI to serve a beneficiary of a special needs trust? The assessment. This is probably one of the most important parts. It allows the time. EBI, we think it's about 10 hours, is about the minimum time it takes to complete an assessment from start to not even finish, just to get a good starting point of what it is like to work with the person. At this time, it would also allow the beneficiary time to get to know who we are, allow them time to figure out what services we offer that they would also want access. The assessment has lots of categories. We're going to talk about their current housing situation, their income, if they're open to it, their health, if they want support in health. They don't have to accept support in health, but we would help with their doctor's appointments if they wanted. We might ask if they wanted support with medication, and if they did, maintaining their refills and teaching them how to do it. We're not doing it for them. We're just giving them the tools so they can do it for themselves. We also would help in areas of making sure that they have all of their community stuff worked out. I think that's important to get to know somebody during the assessment time, is learning about the person, building that relationship, building that connection with the person. And then that sort of allows us to go into the next section of moving forward to working with them. We would ask all of the beneficiaries to be willing to sign a background check and a credit check. This is if they want us to have help with housing. Knowing ahead of time helps us sort of mitigate any barriers or risks that might come up prior to us going out and looking for housing for somebody. For example, someone might have had an eviction, and knowing that ahead of time, we would be able to help at least address that prior to applying them on a wait list for affordable housing. It doesn't mean that we went and applied them, it allows us to know that they have an eviction, so we can maybe work out the details of what happened prior, what led to that eviction. Maybe it was their disability. They ended up in a skilled nursing home during the time when they couldn't afford to pay the rent and they had no one to maintain the unit for them. That's also part of the credit check, just knowing ahead of time prior to putting them on these applications. Again, it doesn't stop us from putting them on these wait lists. Release of information and consent form. The release of information and consent form and standard HIPAA release of information, this allows us to fill out applications on behalf of the beneficiaries and share their personal information, date of birth, address, income, but we wouldn't share any of this information without their permission first. And once someone signs this, we still ask every single time we're filling out something just to make sure that this is what they want. It could be filling out a housing application maybe in Fremont, and maybe the person isn't interested in Fremont. They would prefer to stay in northern Alameda County. A great choice. EBI's Life Planning Program provides a valuable service to both individuals with special needs trusts and to the fiduciaries managing their finances. EBI is well organized for its extensive experience coordinating care of individuals for 20 to 22 years of age and older with a range of disabilities and needs. Ability to navigate and successfully advocate for public benefits and services. Linkage with large array of resources available in Alameda County. Proven commitment to providing cost-effective quality services. Consistent reporting to public and private funders. To access our services, you can see the name and number there. You may contact us or email me directly. Thank you for your time, and give us 1 second and Tom will be joining us for any questions anyone might have.
Okay, I really want to thank you both for coming today and sharing with us. So I've got a couple of questions to go over. First one is housing needs. As we all know, housing is like the biggest issue we deal with our beneficiaries here. Can you tell us a little bit more about, your experience in accessing housing? Are you aware of all the different options in the community and that kind of thing?
Yes, we have a comprehensive database that's run by our employee Leanne, and it has all the affordable housing complexes in Alameda County in the database, and what kind of units and what kind of affordability levels each of those complexes has. And then Leanne sends us an alert whenever there's an open waiting list for one of those affordable complexes that goes to all of our staff that are involved in helping people find affordable housing. So that's one way we stay on top of it. The other way we stay on top of it is we write grants with public housing authorities, and there's 5 public housing authorities in Alameda County. We have a relationship with 4 out of the 5 right now, and right this moment, HUD issued a notice of funding availability, basically a grant for more Section 8 vouchers for people with disabilities. And we're going to be helping the Housing Authority of Alameda County write a proposal for to be considered for those vouchers. The third way that we help people is is we develop relationships with the nonprofit housing development community, and there's a grant available. Again, it's through HUD, but California secured $24 million for affordable housing money for specifically for people with developmental disabilities and people transitioning from nursing facilities. So we talked to all of our affordable housing partners about applying for those monies, and we've gotten 1, 2, 3, 4, 5, 6 affordable housing agencies to apply for that particular grant. It's called the 811 grant in our county, and we're hopeful to get between all those proposals about 100 units of affordable housing for Alameda County. So we have various strategies to help people find affordable housing.
Excellent. Here's another question, and once again, we've used your program now for a number of our beneficiaries already, and I know one of the things that we're exploring is the vocational needs of our beneficiaries when that's appropriate, which I think is just absolutely outstanding. Can you explain a little bit more about the vocational services that you provide and how that might be adapted here?
Yeah, I think first we want to make sure that people are stable, have stable housing, have health care needs that are stable, before we talk about employment. But once people are ready to talk about employment, we have employment services where we serve 150 people in jobs throughout Alameda County in a range of occupations, from working in grocery stores all the way to we have people who've been hired by BART. We have 4 people who've been hired by the district attorney of Alameda County. 4 people have been hired by the sheriff of Alameda County. 4 people have been hired by Lawrence Berkeley Lab. So, and then we have training programs that are embedded with the Claremont Hotel that just started, and a training program that's embedded within the County of Alameda administrative offices. So we work with Department of Rehab. We also work with the Workforce Investment Board. We're members of the Workforce Investment Board of Alameda County. Most of our employment services are directed towards people with developmental disabilities because they have funding through the Lanterman Act that allows for there to be long-term support services to help people maintain employment, which doesn't actually exist through DR. It's a regional center funded service. But for long-term follow-along services for people who don't have developmental disabilities, we do use this program called Ticket to Work, which is a Social Security work incentive program to help beneficiaries of Social Security disability benefits find work.
Great. The other thing is, it mentioned here that you have experience with public benefits. Can you expand on that just a little bit? So you have a basic understanding at least of the SSI and Medi-Cal rules?
Yeah, we have 3 staff who have gone through a credentialing program. They're certified benefits planners. They went through a program with Cornell University that mainly covers Social Security disability benefits and how wages interact with those benefits. I would say, though, Christine's an expert in Medi-Cal, IHSS, the health side of things that are involved with Medi-Cal eligibility, how to keep people on Medi-Cal eligibility, how to deal with share of costs, things like that. So we have lots of internal capacity and expertise around Social Security disability benefits, and also on the healthcare side, Medi-Cal and Medicare.
Great. And then I'm a little confused. I'm learning about this, which is, what's the difference between ILS and SLS, and how would those be adaptable?
You want to take that?
So for the difference between ILS and SLS is the amount of service someone needs. So an ILS, which I think the life planning program that we're starting, which more is suited for that sort of foundation building of it, is because ILS people live independently. They don't require emergency services. In supported living, there's round-the-clock care, 24/7, and there's an emergency team that's set aside if needed. In independent living, people come in maybe 1 day a week, 2 days a week, and do check-ins, and it's a lot of teaching money management, teaching how to maintain their medications, refill their medications if they want to use a specialty pill box. So it's a lot of teaching of skills, and eventually the instructor's no longer doing those things with the person hand over hand. It becomes their responsibility. So in life planning program, that is our hope, is that when we're working with people, we're also teaching life skills. In supported living, there are a lot of the consumers that we serve where it really is up to the direct care provider to be providing these, including giving medications if needed and helping with day-to-day personal care, where in independent living, personal care is managed by the person. Now, if they did need some of those services, this is when we would look at accessing their Medi-Cal benefit of in-home support services. Also, it's the amount of hours. In ILS, we use usually no more than 40 hours a month. In supported living, the minimum we serve someone is about 80 hours a month, all the way up to 24/7.
Great. Okay, well, anyway, I want to thank you for folks both coming today. And for those that are watching, this has been a great program to work with. I do have one last question here, which is that that you're working with the Golden State Pool Trust on this, but is this exclusively with the Golden State Pool Trust, or are you willing to work with other trustees?
No, we're open to work with other fiduciaries, other trustees.
Great. So one thing I know, for many of you, you know that not only am I the trustee of the Golden State Pool Trust, but we're also counsel to many private fiduciaries. For those of you that are private fiduciaries that are listening to this, you know, there's a number of things that maybe you might be able to delegate to EBI or a similar organization. And the value of doing that is that, you know, for many beneficiaries of special needs trusts, having that personal contact with somebody on a regular basis can resolve so many different issues. Here, my expectation is for many fiduciaries that that get engaged in this project, you'll be able to serve a greater amount of beneficiaries and do a better job, and you'll be less likely to get overwhelmed. I have great hopes with this project. This is going to greatly improve the quality of services that we provide to the beneficiaries of special needs trusts. And we're finding, just as we're working on this project, that we're able to offer services and options we just simply never could before. So we're quite excited about this. Anyway, I want to thank you both for coming today, and we're looking further working with you here as as you're the trailblazers with this project here. As we develop this, and then eventually our hope is to spread this project across the state and then eventually across the nation. Thank you so much.
Thank you, Stephen,
Thank you.
for the opportunity.